Pregnancy is an exciting time filled with anticipation. As a mother-to-be, you pay close attention to your health. You know that what you eat and do affects your growing baby. But did you know that some substances can cause birth defects? These substances are called teratogens. Teratogens are everywhere in our environment. They can be medications, chemicals, infections, or even certain foods. When a pregnant woman is exposed to teratogens, they cross the placenta and reach the developing fetus. This exposure can interfere with the baby's growth and development, leading to birth defects. These birth defects can range from mild to severe. Some babies may be born with physical abnormalities, while others may have intellectual or developmental disabilities. The effects of teratogens depend on several factors. The type of teratogen, the amount of exposure, and the timing of exposure during pregnancy all play crucial roles. It's important to remember that not all exposures to teratogens result in birth defects. Every pregnancy is unique, and some babies are more susceptible to the harmful effects of teratogens than others. However, it's always best to err on the side of caution and minimize exposure to potential teratogens as much as possible. Pregnancy is divided into 3 trimesters, each marked by significant developmental milestones for the growing baby. The first trimester, in particular, is a period of rapid cell division and organ formation, making it the most crucial time for fetal development. During this time, the baby's organs and systems are most susceptible to the harmful effects of teratogens. Exposure to teratogens in the first trimester is more likely to cause major structural abnormalities. For example, exposure to alcohol during this time can lead to fetal alcohol syndrome, which can cause a range of physical, intellectual, and behavioral problems. While the first trimester is the most critical period, exposure to teratogens in the second and third trimesters can also have serious consequences. The baby's brain continues to develop throughout pregnancy, and exposure to harmful substances later in pregnancy can lead to intellectual disabilities, learning difficulties, or behavioral problems. It's important to understand that the effects of teratogens are not always immediately apparent at birth. Some birth defects may not be diagnosed until later in childhood, while others may not become evident until adulthood. Now that we understand the critical periods of fetal development, let's delve into some common teratogens and their potential effects. It's crucial to remember that this is not an exhaustive list, and it's always best to consult with your healthcare provider about any medications or substances you are exposed to during pregnancy. One of the most well-known teratogens is alcohol. Alcohol consumption during pregnancy can lead to fetal alcohol spectrum disorders, a group of conditions that can cause physical, intellectual, and behavioral problems. Babies with FASDs may have distinct facial features, growth problems, and difficulties with learning, memory, attention, and communication. Another common teratogen is tobacco smoke. Smoking during pregnancy exposes the developing baby to nicotine, carbon monoxide, and other harmful chemicals. This exposure can lead to premature birth, low birth weight, respiratory problems, and an increased risk of sudden infant death syndrome. Certain medications can also act as teratogens. For example, some prescription drugs used to treat acne, seizures, and bipolar disorder can cause birth defects. It's essential to talk to your doctor about any medications you are taking, including over-the-counter drugs and herbal supplements, before and during pregnancy. Illegal drugs, such as cocaine, heroin, and methamphetamine, are also known teratogens. These drugs can cause a range of severe birth defects, including heart defects, neural tube defects, and limb abnormalities. Additionally, babies exposed to illegal drugs in the womb may experience withdrawal symptoms after birth. Section 4. Protecting your pregnancy steps for a healthy baby. Understanding the risks associated with teratogens is the first step towards protecting your pregnancy. Now that we've covered the basics, let's explore some practical steps you can take to minimize your exposure to these harmful substances and ensure a healthy pregnancy for you and your baby. First and foremost, it's crucial to maintain open and honest communication with your healthcare provider. Before trying to conceive, discuss your medical history, any medications you are taking, and your lifestyle habits. Your doctor can provide personalized advice based on your individual circumstances and help you make informed decisions about your health and pregnancy. If you are planning to become pregnant, consider taking prenatal vitamins containing folic acid. Folic acid is a B vitamin that plays a crucial role in preventing neural tube defects, which are serious birth defects of the brain and spine. Maintaining a healthy lifestyle throughout your pregnancy is essential. Eat a balanced diet rich in fruits, vegetables, and whole grains. Avoid alcohol, tobacco smoke, and illegal drugs completely. Limit your caffeine intake and stay well hydrated by drinking plenty of water. Be mindful of your surroundings and potential environmental exposures. Avoid contact with harsh chemicals, pesticides, and heavy metals. If you work in an environment that exposes you to these substances, talk to your employer about safety precautions you can take during pregnancy. Section 5. The importance of open communication with your doctor. Throughout this discussion about teratogens and their impact on fetal development, one recurring theme remains constant: the importance of open and honest communication with your healthcare provider. Your doctor is your most valuable resource during pregnancy, providing guidance and support every step of the way. Never hesitate to ask questions, express concerns, or seek clarification about any aspect of your pregnancy, especially regarding potential teratogen exposure. Your doctor can provide evidence-based information, address your anxieties, and help you make informed decisions that prioritize the health and well-being of both you and your developing baby. Remember that every pregnancy is unique, and your doctor can offer personalized advice tailored to your specific circumstances. Sharing your complete medical history, including any pre-existing conditions, medications you are taking, including over-the-counter drugs and herbal supplements, and your lifestyle habits, is crucial for your doctor to provide comprehensive care. Furthermore, if you have concerns about potential teratogen exposure, don't hesitate to bring them up with your doctor. They can assess the situation, provide reassurance, or recommend further investigation if necessary. Open communication fosters trust and empowers you to actively participate in your prenatal care, ensuring the best possible outcomes for both you and your baby. Section 6. Conclusion. Knowledge is power when it comes to pregnancy. Pregnancy is a transformative journey filled with joy, anticipation, and a profound sense of responsibility. As you prepare to welcome a new life into the world, it's natural to seek information and guidance to ensure a healthy and safe pregnancy. Understanding the potential risks associated with teratogens is an essential part of this journey. By arming yourself with knowledge, you can make informed decisions to minimize your exposure to these harmful substances and protect your developing baby. Remember that every pregnancy is unique, and what may be considered safe for one woman may not be safe for another. Open and honest communication with your healthcare provider is paramount. Your doctor is your trusted ally, providing evidence-based advice, addressing your concerns, and supporting you every step of the way. Together, you can navigate the complexities of pregnancy, minimize potential risks, and embrace the incredible journey of bringing a new life into the world. Remember, knowledge is power, and by staying informed and proactive, you can ensure a healthy and happy pregnancy for both you and your baby.